Hi, my name is Corey Gentges, and I'm here to do my week 15 assignment. And there's a couple things that I'm going to review related to healthcare management consultants. So this is over chapter 15. Um, the book kind of goes over that there are many different ideal characteristics of healthcare management consultants, and they list the main ones as integrity, competence, fidelity, honesty, justice, dignity, and commitment to learning. After reading through the list and reflecting on my own qualities, I decided there are two specific qualities that I already possess. The first one being a commitment to learning. And I feel like I have this specific quality because currently I'm expanding my professional education by obtaining a Bachelor of Science in Health Services. And by December 2020, I will have obtained my Master's in Health Administration. So their kind of definition of commitment to learning is continuing professional education or continuing professional development. So I'm kind of continuing my professional education with my bachelor's and my master's, but I'm also continuing my professional development through, because I'm currently a certified dental assistant here in Springfield. And to continue my professional development and to maintain my certification, I have to get 12 credit hours of continuing education. Some of the hours are in specific areas such as infection control and HIPAA, or the Health Insurance Portability and Accountability Act. So those are two areas I have to get training on each year. But the other hours can be geared towards like someone's personal interests. For example, one year I think I had over my 12-hour limit, but I had like 20 some hours related to implants because I went with a doctor to an implant course in Louisiana. So I was able to count that towards my continuing education credit. And also, there's a lot of different websites you can get your continuing education online. So that's how I do it a lot. The American Dental Assistants Association has a website, and you can go there, and they offer a lot of free CE courses there. But overall, I'm a lover of learning. I really enjoy my education and learning new ideas and concepts. And I also really enjoy sharing new ideas with others. So, for example, throughout high school, I enjoyed being a teacher's aide, and I helped all their students. When I was in dental assisting, I was president of my class, and I just kind of enjoyed being in that leadership role and being able to provide assistance to those who need it. And the dental field is nice because I'm able to work in the healthcare sector, which I've always really wanted to do, and take care of others. But I'm also able to educate patients at the same time. So one way that I educate patients is post-operative instructions. So if someone comes in for a tooth extraction, I'm able to review how they need to take care of themselves after that appointment. So it's really nice, and I really enjoy it, and patients need someone who's confident in their skills to educate them and make them feel comfortable and that they can do it. Another quality that I feel like I already possess is the quality of integrity. Those who have this quality fulfill their commitments, or they keep their promises or agreements. Beyond this, they also are generally good and virtuous, or kind, honest, fair, upright, and consistent, compassionate, and willing to uphold personal moral principles despite opposition, adversity, and ostracism. So that's a really big definition for integrity. But really, I've always kind of looked at integrity as it consisting of doing the right thing even when no one else is looking or no one else is around. So, let's say through the dental field, like if I'm cleaning a room after a procedure, then I'm gonna clean it really well, even if no one else is in there watching me, because I'm doing it for the patient and for my team. I'm not trying to get away with it super quick and do a really bad job, but because I know the importance of cleanliness in the office, and I value my patient's health. So, like I said, doing the right thing even when no one is looking. My whole life, I feel like I've consulted my own personal moral conscience and asked the question, is this the right thing to do? And this thought has kind of helped me develop the quality of integrity in my everyday ethical handlings, including my professional field. So even when I was younger, into middle school, high school, and now in my professional field, I'm always asking, is this the right thing to do? And even if no one else is watching, because that's all about integrity. So even though I feel like I have those two personal qualities, there's also some I probably need to work on in order if I were to possibly fill a role as a healthcare consultant. So one of these I thought would be competence. Competence, the book defined it as a specific and measurable pattern of behaviors and knowledge that generates or predicts a high performance level in a given position or context of responsibilities. So another kind of drawn out definition, but I feel like competence this quality comes with age. It comes with education and experience. My own personal level of competence in a professional field will only increase with age, education, and years of experience. So, I'm trying to apply for jobs right now related to my degree I'm getting, my bachelor's degree, and a lot of places want like 5 years experience in that field, and I may not have it right now, but I will one day. So that's just something I need to work on. Another one I thought maybe could be justice. The textbook mentioned that the idea of unconscious biases, and they could cause unintentional mistakes, which could then lead to an injustice in the profession. I feel as though an improvement in this area is probably warranted. However, I also believe an improvement in this area comes with age, much like competence. Because an individual, as they get older, they may become more aware of their thoughts and then the related actions to those thoughts. So those are two places that I thought that I could improve on. In my current professional setting as a certified dental assistant, I have had experience with healthcare consultants. The dentist I work for now actually hired a dental office consultant company called ACT. And they did this before I was at the office. So the whole team went to Kansas City and they worked as a team with the consultant company. And they kind of helped guide the practice to where it is today. And I believe this consultant company really helped show the dentist and the team the areas that needed improvement and also how to reach specific goals. So we still use the same kind of practices and goals that they taught the dentist back when they first spoke with ACT. And this is very important, especially for a dentist that's trying to practice his expertise as a dentist while also trying to run a business. And when people go to dental school, they aren't there to learn how to run a business. So everyone can't do it all. They need help. And I think consultant companies can really help in this arena. This company specifically, I saw the quality of dignity. This company, ACT, upheld the positive image and reputation of their profession by acting respectably and honorably. They treated our office with respect while also not putting any other consulting company down. And I think this is really important. We also try to do this in our office. For instance, if a patient comes in and they kind of had a bad experience with another dental office, we really try to not put the other dental office down because we don't know the scenario or situation that dentist or office was in. So we just kind of want to base the patient's experience with us individually and not compare it with any other office. But in this role, individuals as healthcare consultants will probably face many challenges. One of the first ones that come to my mind related to this role is the fact that healthcare consultants will not be able to make every person happy. And this is kind of everywhere in life. But sometimes certain decisions will be made, and it will make some people happy, and at the same time, it may discourage or make others unhappy. Also, in this position, it's very important to be honest. Being honest may not always make people happy, but consultants have to be honest with their clients in order to provide suggestions and solutions to problems. Um, those consultants have to be honest about maybe what's not being done in the correct way, or even if it's not correct, maybe it's not like the ideal, it's not having an ideal outcome, and those consultants have to be honest with their clients, or there's not going to be any change made. And also, healthcare consultants need to be positive people. They must be goal-oriented and remain in good spirits. Not every client will be positive or gung-ho about making changes. Change is scary for people. Change is uncomfortable. And sometimes clients will fall through. They will not make it through. They will not continue with their goals and the different policies and procedures they've suggested. But healthcare consultants may find it challenging at times to remain positive and upbeat throughout their career as a consultant, especially through difficult times. So those feel like are the main challenges that healthcare consultants will face in their career. Thank you.